Good evening, everyone. In light of the COVID pandemic, it's a fair remark to make that now more than ever, we need to put a greater emphasis on how important our health is. It's also a fair remark to say that those who are at most risk for succumbing to the disease had one or more comorbidity, whether that be obesity, diabetes, or even hypertension. With the world around us beginning to open up again, and people beginning to resume their lives, the time's come for us to truly understand that the greatest tool that we have at our disposal is health when it comes to our overall well-being. There are a few questions that we need to start asking ourselves. Who's responsible when it comes to our health? What choices are we making that's stopping us from improving our health? How do we become more preventative as a society? And finally, is it time we embraced holistic health? Good evening, everyone. My name is Harsha, and I'm a new member of the Tattva Network. I'm a self-proclaimed fitness enthusiast, but before I go any further, let me introduce Tattva to you. We're an independent publishing house and authorship program focused on developing creatives, writers, and thought leaders united in the vision of building a world that is truly diverse in its ideas. We've published books from politics to feminism to decolonization and identity. So give us a follow on our socials and subscribe to our YouTube channel. We have lots of content like this coming up, so stay tuned. So without further ado, let's get stuck into our fantastic panel who I'm really excited to have on today. Now I want to introduce our first member of the panel, and that's Dylan Patel. Thanks for being here, man. AKA DNA Fitness. 5 years ago, he was battling Hodgkin's lymphoma, which is a rare type of cancer. And after beating it, he left his office job, went back into studying and became a personal trainer, a martial arts instructor, and a nutritional advisor. Nowadays, he helps people change their lifestyles through exercise and nutrition. So thanks again, Dylan, for being here.
My pleasure, man.
No worries, man. Next, we have Snehal Shah. She's an author and journalist within our Tattva network. She's appeared, her works appeared in The Guardian, BBC Radio 4, The Economist, and many more. Recently, she's produced a book called Dissecting Ayurveda. It provides a comprehensive, detailed overlook about the medical science, the social and political details around Ayurveda. So give it a read. Finally, we have Dr. Rajiv Chandegra. Thanks, Rajiv, for being here. I know you've had a busy day, so appreciate it. He has an interest in humanities and global health, and it'll be really interesting to see his perspective from the NHS when it comes to holistic health. So once again, big thanks everyone for being here today. It's great to have all these experts on board, and we're going to have a great discussion. A bit about myself. So the reason why I chose to do this topic and the reason why I'm here doing this live cast with you guys today is it's a topic that really resonates with me and it means a lot to me. It might not look like it now, but once upon a time I was a pretty big kid, and I think big kid would be understating it. I was pretty overweight. I mean, if I were to paint a picture for you, I'd be the guy dreading PE, or if you've heard about the bleep test, don't even ask me about it. It was terrible. But one day it came to it that I really wanted to change how I was, how I looked. And that came with a lot of struggles. It involved running when I couldn't run. It involved pushing my weight when I couldn't push it. It involved eating less and eating differently. So much so it's become a lifestyle that I look at nutrition, I look at my mental well-being, and I look at my physical fitness. And that brings us onto our topic of holistic health. It's a broad topic, and I appreciate the nuances and the breadth of the work that goes into it when you talk about holistic health. But today we want to get stuck into the conversation, and let's just get the ball rolling and start it off with defining these terms. So I offer this question to you, Rajiv. What do we mean by when we say holistic health? Why is it important, and why should we care about it?
So thanks, Harsha, for inviting me. I think first of all, there's so many definitions of good health or holistic health. And I think the one that I came across, which I think resonated me in such a practical way was the reduction in the fear of becoming ill and making people sleep better at night.
Okay.
Because poor health, whether it's biological, psychological, social, stops you sleeping at night. So
Sure.
I think the complete sort of complete overall picture of healthcare for me would be optimal biological, psychological, and social well-being.
Okay, sure. That's good. It's a good start. Now, I'm going to throw this one to Dylan. As a PT, as someone who works in fitness, what would you define holistic health, and how is that a part of your career?
Yeah, I mean, I agree with what Rajiv just said. He's worded that quite well. To me, holistic health is everything he said, and I like to look at it as mind, body, and soul. I think those are the three parts of our life that we always need to look after. However, most of us neglect most of them. You know, if there's a lot of people that kind of look after their bodies, but then when it comes to the mental side of things, it kind of slips. And like you say, it stops you sleeping at night. So I think it's encompassing everything that life has in it, not just one aspect of it. So it's looking at everything as a whole, which is where the term holistic comes from. So I like to look at it just as every part of your life dissected, making sure every part of it is correct and right and healthy.
Of course. No, sounds good. I mean, especially the mind, body, soul aspect. But that's something we're definitely going to be talking about. So we'll get to it. Okay, now, Snehal, you've done a book on Ayurveda, and that's involved lots of research and talking to practitioners and patients alike. So with that in mind, I'm not going to ask you what do you mean, what do you think holistic health is, but I'm going to ask you, why is Ayurveda and holistic health one and the same? So just give us audience a bit of a background when it comes to Ayurveda.
Yeah. So hello everyone. It's great to be here. Thanks, Harsha. So Ayurveda is like, just to strip it down to its basics, ancient Indian health system. And we believe it's about 6,000 years old. But crucially, it's a sort of it's a system born in oral traditions and community traditions rather than sort of academic texts. So the academic texts are about 4,000 years old. But what Ayurveda is really founded on is exactly what Rajiv and Dylan have been saying about mind, body, soul. So, you know, the ancient Indian sort of concepts are a bit different. Like the spirit probably captures what we mean more than soul. But health is really a united sort of lifelong endeavor. And I think also what Ayurveda brings out is just how social health is. So it comes into our own social interactions and everything, but also into community. And I think that's the key of like holistic health, is that it's not just about the individual as a whole, it's about our society as a whole.
Right. No, that offers a lot, but I think for now, I think since that's such a broad thing to cover, it's gonna be covered in the session, but I want to link it back to the nutrition aspect at first. Now I'm gonna go for what Dylan mentioned in one of his YouTube videos, and he said food is medicine, and it's an interesting claim because it really stuck out for me. So Dylan, when you say food is medicine, what does that mean to you?
I mean, it's a saying that we've heard a lot of times. I think is it Socrates or someone that said, "Let food be thy medicine, and medicine be thy food." To me, it means I personally believe that the way the world was made was for us to live off it completely naturally. Everything we have, any ailments we might have in our life, whether they be mental, physical, whatever, there is a natural medicine for it. And I think food is the biggest one. I mean, for example, the best example I can give is myself. When I got sick, when I was diagnosed with cancer, that's when I was first actually introduced to the whole concept of Ayurveda. It's when I actually went and saw someone about it, and she kind of flipped my mind on how food actually works. and she kind of devised me a sort of way of eating. I wouldn't like to say a meal plan, but the foods I should eat and the foods I should avoid to kind of keep the cancer at bay, help fight it off. Damage limitation, because I was having chemotherapy at the time as well. So
Right.
that's very damaging to the body. So protecting the body in that sense. And that's when I first started looking a little bit more deeper into it. And yeah, food has so many health benefits
Mhm.
and can help. Like, for example, the last couple of days, I've had a bit of a dodgy throat.
Right.
Not coronavirus, just a bit of a tickling throat. And every time that happens to me, I reach for ginger. I just take fresh ginger, brew like a ginger tea out of it, grate the ginger up, and no lie, in 2 to 3 days, I'm usually as good as new.
Sure.
And it worked again. So I feel like, just like I use ginger, there's something for every sort of ailment. And I think everyone just needs to be a bit more educated on what kinds of foods they should be eating, and also the negative aspects of certain foods too, because it is very medicinal. But like I said on my YouTube video, I feel like the world we live in now, it's very pharmaceutical dominated, and I think a quick fix in pharmacy is what everyone kind of goes for. Everyone reaches for a pill when there are other ways to treat things.
Okay, very interesting, because you said everyone reaches for the pill rather than trying to treat them. We're not saying this is an attack on Rajiv and his profession, but no, we're gonna shoot this one straight to Rajiv. So Dylan just suggested how much food has a role and impact when it comes to our health, and from what I'm understanding, he's covering from more of a preventative outlook, as opposed to give me the pill, give me the treatment, let me fix it, let me do something beforehand so I don't have to go through the motions, right? So so could you just tell me what you think about what Dylan's just said?
Yeah, I mean, he's absolutely right. Food should be our medicine. We are essentially, you could say, we're comprised of these 5 elements, and food and water are sort of primary to making up our body composition. I suppose the difficulty is, one, usually all the stuff that's good for you doesn't taste great, or at least our taste buds aren't habituated to like that kind of food.
Right.
And I mean, I'll give you an example very recently of a patient who, she hasn't drunk water in 2 years because she doesn't like the taste of it. Instead, her main beverage of choice is Red Bull. So you can see how, and that's become very normal for her. So I think the one big challenge is obviously taste buds, retraining taste buds. And if we can figure out a way of doing that, then we're onto something. And I think the second thing is there's a distinction between health and healthcare.
Okay.
GPs and any health professional is charged with the responsibility of healthcare.
Right.
But healthcare is a very small subset of health. And obviously there's you could say a tussle between whose responsibility is health.
Sure.
And with the way the current healthcare system is, and maybe we'll look into the kind of the systems perspective of healthcare. With the way the current healthcare system is, we've really got to try and establish when it comes to things like good diet, good lifestyle, having plenty of exercise and things. Whose responsibility is that at the end of the day?
And we'll get to that part in a bit, because I think it's definitely a huge aspect when it comes to holistic health. I mean, whose responsibility is it? But just touching on what you said earlier about the food and the patient who drank Red Bull for 2 years instead of water, I still can't get my head around it. I know Dylan's scratching his head as well.
I'm ready to walk out. I'm done.
Okay, but I think this is more about, you did talk about healthcare and health. As a GP, have you had to prescribe a sort of diet or nutrition plan to one of your patients? And is that something you did early on in your career?
Yeah, I mean, I've been in the NHS for the last 10 years, and I think initially when you start off, it's this kind of very idealistic way of managing. And I know definitely early on in my career as a GP, I would really instruct patients that this is the diet you need to follow, this is the exercise regime, because and maybe Dylan can come in here, but one of the biggest things about a diet and an exercise regime is not necessarily the intricacies of it, but it's actually providing structure to your life, like a good, healthy structure to anchor the rest of your life to. And I used to do that a lot for patients. But I think, I suppose what you realize is that, and again, something, one of the attributes of the modern healthcare system is this kind of collectivized pool of patients that you've got to manage.
Right.
It's very difficult to have effective, individualized programs for patients within the GP consulting room.
Sure.
Normally our consulting time is about 10 minutes. And because of COVID, that's been reduced to about 7 minutes.
Sure.
So individualized care is very tough, especially in the modern healthcare system.
So to summarize, what we can agree on is that whilst it's probably better if we do have an individualized approach for each of the patients that come in, it's just the way it's all set up that you can't go through every detail of that person's life to know what they need to fix about their life to stop them from getting sick. I know Snehal's really edging to jump on this because I know she has a lot to say when it comes to systems. We had a little conversation the other day, didn't we, Snehal, about you said something about the system disempowering people. Now, I really want you to talk about that in depth. So go for it.
Yeah. I mean, I guess just generally, when we talk about healthcare, we talk a lot about the individual, and it is in many ways our experiences with healthcare are individual experiences because there are bodies.
Sure.
But then when you look at the system and the history of Western medicine, which we call clinical medicine, it's based on trying to look after the health or well-being of society as a whole, so big populations, trying to control infection and things like that. And then when you disseminate that to real people who are individuals who have their own like various priorities and worries, and as Rajiv was saying, even tastes, like someone's going to prefer Red Bull to water. I don't know why, but that's where you get a lot of problems. And I think one of the things we do with our healthcare system is we have a lot of expectations on individuals that we have this sort of like clinically proven treatment or strategy or some scientifically proven or scientifically logical way of getting better, like you drink 8 glasses of water a day and you'll be healthy, or you eat your fruit and veg and your immune system will be strong or something. Mm-hmm. And that puts a lot of emphasis on the individual, and every individual is in like their own sort of personal sort of bubble and their own world. And that means that there are so many other factors that come into play. And I think like Dylan and Rajiv, you probably both have seen this, that like when you're dealing with individuals, I don't know, have you found that like you have to tailor the sort of the broader scientific advice and logic to an actual person who has their own sort of difficult like personal lifestyle?
Yeah, I mean, I deal with clients on a daily basis, and each one is treated as an individual because everyone is so different, like you say. And although there are guidelines on what we should be doing in order to stay healthy, everyone's lives are so different. I have clients who work night shifts. It's hard for them to get 8 hours of sleep, for example, because they're having to sleep during the day when there's lots of noise and things going on around them, stuff like that. So there are guidelines, but like you say, everyone is so individual. And it's probably where doctors probably do struggle. If you're saying you've only got 7 minutes to kind of help someone, when I'm making plans for people, it takes me a minimum of an hour at least for one person, just to dissect everything and then put together a functional devised plan that is going to work for them. It takes a lot of time. So it's hard to do it for the whole population as a doctor, I'm assuming, because you just don't have the time for it. But yeah, I mean, everyone is so different, and it's one of those things. It's how do you deal with that? Do you know what I mean? How can someone help every single person? It's pretty much impossible. So kind of linking back to what we said at the start, in the sense of whose responsibility is it then it must be down to each individual, you know, and getting that help from the people that can provide you with it. You know, if someone needs an exercise program, for example, not to say being a GP is wrong, but there's no point going to a GP just for an exercise program. Go to someone who specializes in that, like a coach or a trainer who can devise that for you. So I think each individual then needs to take it upon themselves to say, right, this is what I need in my life right now. This is what's going to work for me, and this isn't going to work for me. And take it into their own hands. You have to take your health into your own hands at the end of the day.
Sure. No, it's really great. Just another thing for everyone watching, the audience tonight. If you have questions, please drop them down in the comments below, and we'll try to get to them by the end of the session. So yeah, please do ask away. Now, Dylan, you brought some really interesting points about how it is different for everyone, and you can't just go to your GP and ask for a fitness plan, because that just wouldn't go down well. But I think what we've covered so far is that, yes, health does need to be approached on an individual basis to understand them, and obviously understand the ailments and see exactly what needs to be done. But then we're saying, how does the individual go about this, and how do they take charge of their health? How do they take charge of fitness? And I hope we can all agree here that comes with some sort of education. Now, with that, Rajiv, I want you to kind of walk me through what would the ideal scenario be. How would we go about having that onus and having that responsibility to take charge of our health and make those decisions in an ideal world?
Yeah, it's an interesting question. I think I just want to you know, Snehal brought up this idea of the system that we live in, right? So an individual isn't an island. We're essentially social animals. So we do connect with other people. We get influence more from the environment than anything else. I think self-motivation is probably accounts for maybe 10% of the change that we enact in ourselves and in society. But I just wanted to weigh in on the challenge that we need to address. And I think there's two phenomena that have emerged, particularly in the Western, in the Western part of the world. And maybe I'll just touch on the first one, which is there has been an emphasis, the healthcare systems of the world.
Could you repeat the last bit? You just blanked out for a sec.
Oh, sorry. There's been an emphasis in recent history, probably in the last 100 years or so, of healthcare systems transforming not to necessarily improve health, but to make access to health fairer.
Okay.
And so our systems have been designed for fairness as the outcome, as opposed to optimal health and well-being. And, you know, just to give you the example of the World Health Organization, in their constitution, they assert that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic or social condition. And from that emerges this concept of universal health coverage, which is essentially based on these three things, which is comprehensive healthcare services,
sure,
quality healthcare services, and probably the most defining one is all these being provided without an individual or a family being exposed to financial hardship. And it's that last part which changes the whole game. We go from an individualized model of healthcare where you've got a relationship, a great relationship between, you know, in the East, we'd call it a Vaid, in the Ayurvedic system, or in the West, you'd call it a family physician, where you've got this kind of personal one-to-one interaction, to this model where we are pooling our resources, our wealth, into this kind of third party, which we call government, or what we call social insurance,
Right.
to collectivize our health care resources. And essentially it's that that's providing for our healthcare. So can you see how in a collectivized system, it's actually very difficult to even think about individualized healthcare. And you know, it comes with so many challenges. And like I said, it's based on like we all agree that the NHS is an extremely fair system. Whether it supports optimal health is a different question, but it depends on what we as a society value the most. So I think, you know, and I'll give you an example. You know, Snehal again touched on it. This idea of this obsession of working on averages, right? We treat an average. Now nobody fits into an average. An average is of a whole of 100 people. The average is this, and we to treat averages. And when you have a system where like the NHS, where the entire funding for it comes from the taxpayer, you've got to work on averages. You've got to opt for the most cost-effective approach,
Sure.
even if that sacrifices the individualist approach. So I think we've got a real challenge on our hands because of the system, and it's a necessary system because we want to make access to healthcare fairer.
So
Can I just jump in there, Rajiv, because I so very strongly disagree.
Okay.
So two things, like you said, NHS is fair, and I think for what it was set up to do, which is promote community healthcare, it is quite fair. Like, it's fairer than a lot of other global healthcare, a lot of other healthcare systems around the world, in terms of the principle of having free, accessible care to everyone. As you said, pooling our resources so that the community, or not really community, but the state, takes care of us rather than our own communities and families.
Yeah.
But then when we talk about fairness, when it comes to the individual, and especially from my research, so many patients said it isn't fair. And maybe it's like a semantic issue about what fairness is.
Yeah.
But the most common issue that so many of the patients I spoke to was the NHS is just not able to serve their health needs, and that doesn't feel fair. So maybe it's something like the struggle to get a GP appointment, or the fact that they're waiting an hour to see their GP and the GP's running late, or it takes like 6 months to get a referral pushed through and like a year to get your surgery sorted out. And maybe that's the same for everyone in that NHS trust or that area or the country. But in terms of our right to healthcare that our state has promised us, it's just not there. And I think that feeling of fairness is just completely absent.
Interrupt for one sec. Can I just interrupt you for 1 sec? If we were to look at idealistically, what would you say the solution for it would be? What would a fairer system in your opinion look like?
I think our idea of a national healthcare system needs to be reworked into something focused on prevention rather than curative or treating the symptoms. So we try, the NHS is primarily focused, and clinical medicine really is primarily focused on tackling or treating diseases after they emerge.
Sure.
And now we see that the NHS is pushing for, or the Department of Health is pushing for sort of prevention with things like teaching us how to live healthily, healthy eating, stuff like that. But because the institution as a whole isn't structured on prevention, it's structured on treatment, it's really struggling to achieve that. And actually something like Ayurveda is so much better focused on prevention. And that's really what we need. We need to, I mean, it's better for individuals and people to never get sick rather than have to be treated for their sickness. But also I think that the kind of strain that our healthcare system is under, prevention is more crucial now than ever, because the system as it is not able to meet people's health needs. And so the only option is we reduce the number of health needs that people have, or like medical treatment needs that people have, by promoting healthy
that's great. Can we we've looked at the bigger picture here of how the system works and how it's either not catering for the individual, and you've spoken about how we need to be more preventative rather than curative. And let's take it all the way back down to see what individuals can do to be more preventative. I mean, let's look at issues like preventable comorbidities like diabetes. Let's look at obesity. When back from NHS figures from 2018, 2019, there was over 800,000 patients in the NHS from illnesses that have stemmed or were attributable to obesity. So that's want to take it to Dylan, and I want to make this kind of lighthearted, because when I think about it, I'm an Asian male. I come from a household that makes curries on a daily basis. Stick with me, right? And there's so much when it comes to nutrition, like MyFitnessPal. There's counting your calories. I don't know how to count calories when it's in like a dal. Like, I don't know what. Like, could you break down the concepts of macros? What should we be thinking about when it comes to our diet? Because for me, I like to keep healthy and fit, but I think to some degree, when I keep eating this kind of food, it's just going to catch up with me later. And I don't know if I'm doing the wrong thing or not. I'm sure the rest of the audience feels the same way. So if you could break that down for us, that would be great.
Yeah, I mean, counting calories and macros, again, you hear about them so much, but it confuses so many people. So I'll try and keep it as simple as possible. Your macros or macronutrients comprise of your proteins, your fats, your carbs, and alcohol is also counted as a macronutrient, but I leave that one out completely. It's not something I want to get into right now. But if we just look at protein, carbs, and fats, right, it's about what ratio of each one you have in your body to maintain health. And then it kind of depends on what you're trying to do. For example, if someone is hitting the gym and trying to grow muscles, then obviously they need a higher ratio of protein in comparison to the carbs and the fats. If someone is trying to lose weight, etc., you kind of tweak them depending on the person's goal. But for general health, I'd say I always recommend to clients, you want your proteins to be between 30 and 40%. You want your carbs to be around 30 to 40%, and then the remainder will be fat, which is usually around 20, 25%.
See, with that comes with a lot of education, right? Because if I'm honest with you, I mean, it's not like I'll go to school and I'll know what macros are. I mean, from what I understand in school, we have the food pyramid, and that's about it. And I'm not even sure that's 100% correct.
They had like these pyramids and these plates and all sorts of that. I think the problem is, like we say, when you're looking at it as a system, if we take the education system, I think that's where there's a big issue too, because like you say, we're not taught these things from a young age. We as kids, you don't question things, right? Your mum puts the rice and curry on a plate for you, you're going to eat it. You're not worried about what's actually in that. It tastes good, I'm going to have it, and this is what I've had my whole life, I don't know any better. So I think if we were educated from a very young age, I'm talking primary school, just the basics of what carbs do, what their purpose is, what fats do, what their purpose is, and proteins. Then growing up, children would question food a little bit more and maybe look at it slightly differently rather than what just tastes good. Similar to you, I was a very big kid. I used to eat a lot. I remember I spoke to you a few days ago and I was telling you I used to keep a packet of cookies in my blazer pocket. I used to literally get through the whole packet in a day. I'd just keep it in my pocket and pick a cookie out every time I felt like it. And you don't think twice. And no one's there monitoring you. No one was there keeping an eye on me saying, why are you eating that many cookies? You know? So it comes down to education. And I think kids need to be taught from a young age. When it then comes to tracking macros, you mentioned MyFitnessPal. It's a free app that I recommend to everyone. I saw something on Instagram about it the other day, and it said, use it like tracing paper. So you know when you don't know how to draw, use tracing paper. Not that you're going to use it forever, but just to sharpen your skills.
Right.
You use a tool like that purely for that. So you might start off by having to count calories and keep an eye on your macros, but that's how you're going to learn. That's how you're going to learn what different types of food contain what proportions of each macronutrient. And then you're going to learn more about your own eating habits and things like that. And then eventually, when you have that knowledge, you can then step away from it, and you kind of just, like, for example, myself, I don't really track my calories or my macros anymore. Just years of eating in specific ways, I've kind of learned what works for me and what doesn't, depending on whatever my goal is. So I think it's, number one, it's overcomplicated. I think people just see the term macros and macronutrients and think it's fitness talk, I'm going to stay away from it.
Yeah.
And number two, it's because we're not educated from a young age on it.
Of course. And so this is an open one for all of you, right? So we've just been talking about food, and I'm assuming everyone here has somewhat healthy lifestyles. That's why I've got you on this video card. So what's your least favorite food that you eat purely for the sake of its nutrition, and I have to get it down my system one way or another? Open.
I can tell you what I really didn't like eating as a child.
What was that?
But now I absolutely adore eating. Is I can't remember the actually the name in English, but is it bitter gourd? So karela.
Yeah.
Right. I used to, like most kids, just hate karela, but I think I just got used to it, and now I really enjoy it.
Yeah, it's one of the things I still avoid. Still haven't had that yet.
That's the one with crocodile skin.
Yeah, that's the one.
Not about that.
Well, no, it's been good so far. We've been talking about a lot about nutrition. We've talked about the individual, and Rajiv, right at the beginning, you did mention the biopsychosocial system. I do want to bring this in the conversation too, but I do want to talk a bit about fitness. I want to talk about walking, and I want to talk about what we aren't doing correct. The thing is, I think for me personally, when we talk about fitness, when we talk about going to the gym, it just seems like, oh, he's just a fitness freak. Oh, he looks at what kind of foods he eats, and it becomes such an unnatural thing to a lot of people. I mean, you seem more abnormal talking about how much weight you're lifting or how much you're running, you're doing in the gym or outside the gym, as opposed to when people just say, I'm just going to go home and watch Netflix. Not that I've got anything wrong with Netflix. I watch Netflix too. But I think it's more about how do we foster a culture of when people are more inclined to start thinking about, how do I get myself moving? Why is movement so important? And worst case scenario, if I'm not moving, how does that link into things like diabetes, heart disease, and whatnot? So my question more specifically is, this is for, I think this is for anyone really, and we'll build from there, is how do we start talking about fitness and making it more mainstream?
Does anyone want to jump in, because I'm itching?
Go ahead, Dylan.
What I say to people is, look at your body as a car. I always use the car analogy. When you buy a car, if you were to keep it in your driveway and you didn't use it, just left it off for however long, and then after a while you go and try and start it again, most likely it's not going to start, or it's going to have problems. You have to keep the car moving. You have to keep using it. Same way as your body. Our bodies are machines. Right? Our bodies are purely designed just to keep us alive. They're machines, and it's use it or lose it. You know, people that have very sedentary lives are usually the people with health issues, purely just from not moving enough. And I think the world we live in right now, with technology and the way, there's not a lot of manual labor anymore. There's a lot of office-based jobs and things like that. And people are sitting down a lot more now. You know, people aren't walking to places. Everyone has a car now. You know, there's more cars on the road now than I've ever seen. I'm on the motorway all the time. Trust me, it's a nightmare. Too many cars everywhere. So everyone's constantly sitting. Even if they're going to work on the train, they're sitting on the train then. If they're driving, they're sitting in their car. People don't move around a lot. And I did a podcast on it recently where we actually talked about preventive medicine. And we broke down, I had an NHS GP on there with me, and we broke down the most common health issues across the world. So we're talking heart disease, cancer, diabetes, obesity, all of those things. And the two factors that kept popping up when it came to actually preventing illness was activity and food. And I know we spoke about the food side of things, but when it comes to activity, it's just as important. Like I said, your body is built to move. You have to move it. And when you said the 10K steps thing, this is something all my clients, I track their steps and they have to hit 10K a day minimum. Because I know that's just the guideline, but that seems to be the magic number. And when people are hitting a minimum of 10K, number one, they tend to lose weight, which you don't want to carry excess of anyway. And number two, it just makes your heart a lot healthier. You know, it's a form of cardiovascular exercise, even just walking. So where we're not being very active, I think that's where a lot of health issues are actually stemming from. We're just too sedentary.
Sure. And Snell, from your research, when I was reading your book the other day, you had a lot of interaction with patients, and when it came to asking them questions about their health or maybe joining a gym, you had some interesting responses. So quickly, do you want to give us a bit of insight into that?
Yeah. So actually, you posed that question, and then Dylan responded, and in my head, I was just thinking, that's such an unfair question. Because I guess so, I was thinking about the patients when I was listening to you, Dylan, and the patients that I spoke to, and a lot of them are older. Obviously, being Ayurvedic patients, a lot of them are sort of Indian heritage, and so they've migrated to this country many years ago. They're adapting to a new society that they weren't born into. And for a lot of people in the Indian community in the UK, but also older people or people who have so many health issues, the challenge of being active is so alien to them. And yeah, we can encourage them to do 10K steps every day or something, and a lot of people do, and I think that's an incredible thing, that someone from a totally different background in society, who's never had to think about their physical fitness because they were just naturally walking to school and running around as kids in the community, and now none of those things exist in our British society today. Mm-hmm. So for them to adapt, I think that's really incredible. Sure. But as a whole, I think it's so unfair to expect people to take the onus on themselves to adapt to the current society, and the fact that we now need to make a conscious effort to be active, because otherwise we're going to have sedentary lifestyles, and it's something that's not possible. And particularly for people of the Indian community, you know, I talk to patients who are like women in their 80s who have been taught that you always wear a sari. How do you go for a walk or a jog in a sari? Or women who've been taught, like, this was actually a much broader problem for a lot of women who are taught, like, your kids have to be fed, your husband has to be fed, the laundry has to be done. There are all these chores that have to happen. It has to happen in a certain order. There's no flexibility. There's no support at home. And life is just so demanding for them. There's no time for them to think about themselves and their health and then get active. And they probably are like quite active in their own way, doing all of these sort of the manual labor that comes with managing a home. But if they have to manage their cardio, for example, because to sort of stave off heart disease or something, that's not something that can fit into their routine, and their routine is cemented in their minds, and that's what we do to people as a society.
Just in the interest of time, we have one section that I want to talk a bit about, and we do have audience questions coming in about 3 minutes, so just keeping that in mind. I want to move, whilst I do appreciate there's a great depth and there's a lot of things to cover when it comes to holistic health, and I really want to talk about the mental, spiritual aspect of it all. Now, Rajiv, I think we can all agree here that whilst it's been disregarded for a long time, we say mental health, but mental well-being, the environment around you, has its ability to manifest into physical illnesses. And Rajiv, I just want to get your experience and how much does this weigh in on the potential to have a physical illness, and how important is it to make sure your brain and mental state is in just as good as working order as your limbs?
I mean, it goes without saying that it's extremely important. I think, you know, we have evolved as society technologically, economically. Society is a lot more complex than it used to be. And one of the measures of that is the amount of choice there is in the world, right? You go and buy a t-shirt, there's 100 different t-shirts you could buy, right? Now, and that choice element is everywhere in every area of society.
Mhm.
And what that means is that whilst all those things have evolved, psychologically, we haven't evolved to cope with choice. And so that mismatch means that we become psychologically very, we're still quite primitive in that sense.
Right.
And maybe there's two things here. Maybe there's a bigger case for having an element of discipline. And I don't want to go down the route of whose responsibility is that.
Yeah.
Say that it's individuals. Snehal may say it's not necessarily the individuals, it's other people. So without going down that route, I think we can all agree that we need discipline even more in our lives now than maybe before in previous generations. And I think we can see discipline as a positive rather than some sort of burden that we're putting on ourselves.
Sure.
I think we're on to something.
Dylan, I'm asking you this because I was listening to one of your podcasts, particularly just about how you talk about health and how you talk about stress. And I know it's a big aspect of your work when you talk about mind, body, soul. So for our audience today, what measures do you take on a day-to-day basis that allow you to, maybe whether it's overcoming mental issues or making sure that the mind is a nice place to live in every day? That's a better way of putting it.
It's hard, man. That's
Yeah.
difficult. I think the best thing I can say is make time for yourself. You can do that in a number of ways. The way I do it, I meditate every day. Every day. So when I wake up in the morning, first thing I'll do is meditate for a minimum of 20 minutes. But I kind of built up to that. At first, I couldn't even handle 5 minutes without a million thoughts coming into my head. But I meditate. And then I visualize. I'm a big believer in visualization.
Tell us more about that.
Yeah, so I'm a big believer in what's known as the law of attraction. I don't know how familiar you guys are with it, but it's basically a concept of like attracts like, and what you put out into the universe is what you get back, of which visualization plays a major part. So I visualize everything that I want in my life, not just physical things, but anything, happiness, whatever it might be. And then I spend time affirming things. I'm also a big believer in affirmations, so just saying things out loud. That's usually what I do every morning, just to kind of get my head right. And then another big part of it is exercise. I always say to people, for me, exercise is like therapy. And I've said this so many times that when I'm training, it's not, it might have started off just because I wanted to look good and be healthy and all of that. But for the mind, I think it's one of the best things ever, because not just in myself, but I see it in my clients that we all have so many things going on in our lives, and there's stress from all angles,
Yeah.
And I feel like when you're in the gym or you're at home, when you're training, that time you spend training, so if you're exercising for an hour, for that hour, you are not thinking about anything else. You're purely focused on the task at hand, which is to get your exercises done, in whichever way you're doing. So for me, it's kind of like a getaway. It's an hour of my day where the world is
for yourself.
Exactly. You just have to make time to do these little things for yourself, I think.
Sure. Okay, so guys, that is pretty much us wrapping up for today, but we have our audience questions coming in. So the first one is from Paris, who says, is one size fits all and prescribing to this idea a cause of the health issues which we face today? Does this stem from an overwhelming amount of information available, leaving people paralyzed? It's a mouthful.
I'd probably say it's it's an element of the problem, because again, you're pooling people into groups, right? You're trying to, because of the nature of modern healthcare systems, you're forced to go down a very rule-based system, a very guideline-based system, because even though we're all paying through our tax, through income tax, actually it's a collective pool that is paying for our health. So that needs to be governed in some way, and that's going to be governed in a sustainable, in an equitable way. Right. So you can't get away from the fact that you're going to have rules and criteria and groups, and you're going to work on guidelines, and so I think that's one thing. So it's definitely an element. What was the second part of that question again?
Second part. So from what we said earlier, does this stem from an overwhelming amount of information available, leaving people paralyzed?
Yeah, this is really important, because the education is what we need. We need empowerment. The problem is when we see things out of context. So I do get a number of patients that come in. I've had patients in the past that will print off academic papers and bring in, and it's great because they've taken such a great interest in their health. But the problem is that often these things are taken out of context.
Yeah, I can imagine.
And you can't do that within health. And it's a sort of a double-edged sword.
Of course. And we do have, sorry, no, go for it.
Oh, I was just going to build on that. I think, Rajiv, what you say, especially about the information and the issue of context, is so valid. But also, more generally, I think we are living in an age where there is so much information, obviously, through social media and more connectivity and the internet and everything. And in a way, that's great. And not just in a way. That's fantastic, because we see alternative medical systems. We can have this kind of discussion. Someone isn't just relying on the doctor down the road for any healthcare issue. But what it also means is that you'll get a lot of misinformation or information and you don't know where it's from. You can't find the context. And actually that's something I found is so common with Ayurveda, that for all of its many benefits, so many Ayurvedic patients are looking at things like social media posts or adverts about turmeric on TV, or
WhatsApp things get forwarded around.
Yeah, exactly. And that's such a, I mean, like, people complain about WhatsApp and have like little rants about it and stuff, but it's actually a really serious issue, because you have no idea where this information is coming from. And especially when if someone forwards you something on WhatsApp that says, say, like, take cinnamon in your tea every day or reduce your cholesterol or something, which I had a few patients who said they got that from WhatsApp. And for them, it seems like their sister or someone really close to them that they trust has given them this information in the way that we would spread home remedies between within families and communities.
Guys,
but really, that sister has got it.
I really don't like doing this, but we have to wrap up with. That's the thing. I'd rather have a 2-hour webcast, but like Tattva told me not to. Okay, so very quickly, in the space of a minute, we want to sum this one up. Is the focus on cure as opposed to prevention so instilled now within the system and mindsets that people are conditioned to take pills as opposed to eat well? If someone can wrap that question up in a minute.
Yes.
Go for it.
That's my answer.
Yeah, I think yes.
Yeah, we just it's like I said, we reach for the pill quicker than we're willing to look at food as medicine, like we said at the beginning.
And what steps do you think, so this is for everyone really, what steps do you think we can take today, just starting from the bottom, not asking for big results or whatever, but what can we do today to start that change?
What can we do, or what can individuals do?
What can the individual do? It's about the individual.
It's tricky, man.
Yeah.
Open your mind. I feel like you said, it's not glamorized, is it? It's not popular to be into health and fitness and look into those things and stuff like that. But if you open your mind, there's so many resources available. I know we said like WhatsApp, social media, all of that. There's a lot of bad information, but there's also a lot of good information on there. You know, YouTube, things like that. We're living in a world right now where we've got so much technology at our fingertips. Knowledge is literally 2 seconds away. Make use of it for a positive.
Sure. So, really, finally, I want to get everyone's thoughts. So I want to start with Snehal. A minute each from all of you. What you'd say when it comes to holistic health? What are your closing remarks on it? And what do you want our audience to take forward from this conversation that we've just had today?
I would say, I think we're moving in a brilliant direction with appreciating holistic health. And I think that's the case across our society. But there is a lot of work to be done. And I think the primary issue with that is about information. And I think Rajiv touched on this earlier as well. But I think the main issue with that is we need more open, honest, and accurate information about how our bodies work. And that really is the key to people learning how to take care of their own bodies.
Mm-hmm. And I want to go to Dylan next.
Yeah, I mean, the fact that we're even having this discussion shows you that it's getting to a place now where people are more aware of it. It's just like Snehal said, it's that final push, you know, to get it past that. And it's tricky. It's hard to kind of convince everyone to one way of thinking, you know, but at the end of the day, you just have to think of it as it's my health.
Sure.
For someone who's kind of had to, I lost my health at one point. I've realized how important it is. And for me, I just wish everyone would open their eyes and see that health as a whole is, without that, you have nothing. It's hard to convince people that, but I don't know how we're going to get people to do it.
But it starts with conversations like today. So
exactly.
Finally, for Rajiv, so would you say holistic health originated from a certain culture, and does that even matter? So it's one we got from Sumit.
I think various kind of, especially indigenous cultures around the world, have always had this emphasis that you have an intimate connection with nature, right? And this certain principles of interconnectedness with not just nature but people around you.
Right.
This idea that there isn't this kind of arbitrary separation between body and mind, and I think, you know, from you know, personally from a Hindu or Indian based tradition, this idea that there's an underlying unity amongst a lot of things out there. Mm-hmm. Rather than this very reductionist approach of we are just parts, and you pick a part out, you sort that part out, put it back into the system, and it's going to work. And it unfortunately doesn't work like that. And I think I would say, more of a holistic. One thing that I would say is that, you know, that the current healthcare system, it's designed not necessarily to improve people's health. And I think that's the misconception here. It's designed to ensure that there's access to health and nobody suffers from financial hardship for their health. Whether that pans out in reality or not, that's up for debate. But I think the one thing to learn is that the system will do what it can, but there has to be a proactive approach now.
Of course. For
those that can.
Sure. And I think that's been great. I think I actually came away learning a thing or two at the end of the discussion. So I think job done. So it's been really great having you guys here. It's been it's been a great discussion, and I'm sure our audience at home loved it as well. It was really great having viewpoints from the NHS to a non-biased way of looking at Ayurveda to a fitness trainer who's gone through the motions and has wealth of knowledge to provide us. So lastly, I'd like to say a big thank you to the audience for attending today. Hope it's been great, and I hope it's got the conversation started. I hope it's put new ideas in your heads, and it's started a new narrative for you as well. As I mentioned, we're a publishing house and authorship program focused on developing thought leaders, writers, and creatives. To find out more, please go to tattva.org.uk. like, comment, subscribe, share it with your friends, share it with your family, share it with a neighbor. Thank you, Dylan, Snail, and Rajiv. You can follow them on social media, DNA Fitness UK. We'll put the links down below. But aside from that, I want to wish everyone a very good evening, and thank you for joining us, and hope to see you guys soon. Good night.